This is what the government is desperate to avoid. Thousands of nurses on the streets instead of in the hospitals. But today, the Royal College of Nursing has warned without progress on pay and working conditions, they will ballot for industrial action. In May, NHS nurses across England were offered a 3.6% pay rise, which would take the average starting salary to £31,050. But this was roundly rejected by 91% of RCN members who voted. In a statement, the union said nurses deserve to be valued, adding, "To avoid formal escalation, the government must be true to its word and negotiate on reforms of the outdated pay structure which traps nursing staff at the same band their entire career." But ministers insist there will be no movement on headline pay. A warning that has also been issued to resident doctors who have just ended their 5-day walkout. But nurses say the profession deserves to be fairly compensated.
We're worried not because nurses don't deserve fair pay, but because every walkout leaves wards dangerously thin. It is a distraction to the bigger problems such as poor management or spending and not addressing the root causes of the problems.
Nurses have urged the government to use the summer to negotiate new terms. But with tension also building between ministers and doctors, it could be an uphill battle to avoid another winter of NHS strikes. So the government had hoped that it had drawn a line under the strikes when they came into power last year, but it seems that those battles between ministers and the health unions are very much continuing. So we know the BMA and the Health Secretary have agreed to resume talks. That's off the back of the 5-day walkout by resident doctors in England. But yesterday the government published a letter from Wes Streeting to the union where he really made clear his frustration on this issue. In the letter, he described their industrial action as, quote, deeply disappointing, and said that they had really squandered goodwill. Now, on the issue of both nurses and doctors, the government says there really can't be any movement on headline pay, but they said they are willing to have discussions on issues like career progression and working conditions. Now, it's estimated that since industrial action began in around 2022, around 1.5 million appointments have had to be cancelled. And so the government's under a lot of pressure on this because it knows that even a couple of days of strikes can have a really big impact on patient care.